So hi, Dr. Lennox Hoyte, fellowship-trained urogynecologist and female pelvic surgeon. And we talked earlier about the fact that most of what we do in urogynecology is treat female pelvic floor disorders in women that are not pregnant. The one rare pregnancy-based procedure that we do in our practice at Pelvic Floor Institute is placement of stitches or cerclages for recurrent pregnancy loss due to painless cervical dilatation. And it turns out that the recommendation for a woman that's had recurrent pregnancy loss because the cervix expanded before viability or before the time the baby could survive safely out of the womb, once that properly is diagnosed in the absence of any other anatomical or infectious disease or other genetic reasons, is to place a cerclage. And this is recommended for placement usually within the first trimester of pregnancy in the 12 to 14 week time frame of the pregnancy. The abdominally placed cerclage is placed long before the painless cervical dilatation develops, and it's placed with an intent of keeping the cervix closed so that the cervical mucus protects the amniotic membranes, the pregnancy membranes, from vaginal infectious disease agents or inflammatory agents. That's the idea. So some women will come and ask, well, can I have my cerclage placed before I get pregnant or after I have the miscarriage? And the stark difference in those two or three approaches has to do with the fact that the non-pregnant uterus is a much firmer structure. It feels more like your nose, and it's harder to get the stitch in the area that it really needs to be in order to be fully effective. That would be the main drawback to that. The blessing of that part is that the blood flow to the uterus is not as massive as it is in pregnancy, but the downside is that you may have a harder time getting the stitch in place. In the 12 to 14 week range, and we'll do our cerclages up to 18 weeks for our pregnant ladies, is that it's really dauntingly increased blood flow to the tissues that really carries a much higher risk of bleeding. Fortunately, the Pelvic Floor Institute does a version of the cerclage that's really quick and straightforward to perform and minimizes the possibility and the potential for bleeding, making it much more effective. The right time is, again, that 12 to 14 week time in the pregnancy, long before any dilatation begins. And sometimes after delivery, within the first 3 months of delivery, the uterus remains soft enough so that if a patient so desires, stitch placement or cerclage placement in that period can also be really effective. The thing that's important to recognize in this setting is that once an abdominal cerclage is placed, it is not removed. So all deliveries after 20 weeks or 22 weeks must occur by cesarean section because the stitch is keeping the cervix closed and you don't want to have those patients labor. So many of the patients in care of an obstetrician will have a scheduled cesarean section just before the full term of the pregnancy to make sure that the patient does not go into labor. You don't want to go into labor with an abdominal cerclage in place. So the right time for your stitch is the 12 to 14 week time frame in the pregnancy, long before the dilatation begins. I've seen patients where it's been done before pregnancy, and I've seen it also done at up to 3 months post-pregnancy, and they seem to have similar effects and outcomes. Be sure to like and subscribe. I'm Dr. Lennox Hoyte, fellowship-trained urogynecologist, pelvic reconstructive surgeon. Please leave comments in the comment box below, and we'll look forward to talking to you. At the Pelvic Floor Institute in Tampa Bay, Florida, we're happy to evaluate you if you feel like you have recurrent pregnancy loss due to painless cervical dilatation and you have a referral or a diagnosis from your high-risk obstetrician or OBGYN. We're happy to see you in that setting. Thank you so much for watching. The abdominal cerclage is certainly available to be placed in pregnancy. Many of us believe that it's not as effective if it's placed once the woman is pregnant. Usually you want to place it very early in the pregnancy or when the woman is not pregnant in order to have it be most effective. What we've found in our practice is that if you place the cerclage in a non-pregnant woman, she tends to do better than if you place it in someone who's pregnant. The rates of delivery seem to be lower if you place the cerclage in a non-pregnant woman, and the rates of premature delivery are lower.